Hi, my name is Rolito T. Patidungan from St. Augustine School of Nursing, Iloilo Branch, under the Caregiver Program. Today I'm going to perform the oxygen administration via nasal cannula. Oxygen administration is a common supportive treatment for a patient with acute respiratory failure and for those with a or chronic lung disease and hypoxemia. The goal of the therapy is maintaining normal hemoglobin saturation so as the facilitate the normal oxygen delivered to the peripheral tissue. The purpose of oxygen administration is to supply or increase supply of oxygen to the body, to soothe the irritated mucous or membrane, to lose a mucus and secretion in the respiratory, to provide high humidity to the liquidity of bronchial secretion, to serve a respiratory stimulant, to facilitate a normal metabolism of the tissue, and to reduce and correct an arterial hypoxemia or low concentration of oxygen in the blood or tissue hypoxemia or hypoxia, to increase the work of the breathing. The articles that equipment that we needed, it is a client charge, an oxygen connector tube, flow mirror, humidity filled with a sterile water, oxygen source or wall outlet or the oxygen cylinder, tray with a nasal cannula of the appropriate size of oxygen mask, kidney tray, adhesive tape, scissors, and oxygen stand.
Go.
Check the doctor's prescriptions including date, time, flow, liter of minutes, and methods. This is to provide the medical error. Perform hand hygiene and wear of gloves if needed or available. This is to prevent the spread of an infection. Explain the purpose and procedure to the patient, providing information that fosters the client's cooperation and allay his or her anxiety. The organization facilities secure the scheduled performance. Prepare the oxygen equipment. Attach the flow meter into the wall outlet or oxygen cylinder. Fill the modifier about 1/3 with a sterile water or boiled water. This is the modifier prevent drying to the nasal mucosa. Blow out dust from the oxygen cylinder. This is to prevent the entering dust from the exit of the cylinder to the nostril. Attach the cannula or the connecting tube to the adapter on the humidifier. And taste the flow setting a flow meter at the 3/3 liter per meter and check the flow on the hand. Before testing or the testing flow, before use it needed to provide the prescription oxygen to the client. Adjust the flow of meter setting to the ordered rate. The flow rate via the cannulas should not exceed 6 liters per minute or higher rates causes excess drying to nasal mucosa. Remove and proper dispose of gloves. Wash your hands. This is the respiratory secretions and considered contaminated. Document the procedures and record the client's reaction. The documentations provide for the coordinations of care, coordination of care. Sign the charge and report to the senior staff to maintain the professional accountability. And check the critically for the depressed respirations of increased pulse. This is to assist the respiratory connection and find out any abnormalities as soon as possible. And check the radar pressure areas under the strap. The strap when is smack plate pressure on the underlying skin areas. Thank you. That's all for today.